Well, good afternoon. Dr. Kane will be on in just a moment to go through our regular data briefing and update. Um, I would simply say that the major takeaway is for about a month, we have seen an increase in the rate of positivity for COVID in Marion County. Now, to be clear, it has not been a dramatic increase, and it is now plateauing. Dr. Kane obviously is in a much better position to explain that than I am, but I'm encouraged that uh, to the extent we have seen an increase, it has been incremental and that it now seems to be plateauing. In fact, our numbers appear to be in line with trends felt throughout the state and, frankly, the country. In fact, our new cases rate, places us in the middle of central Indiana counties, despite having hosted the Ncaa men's basketball tournament, and despite our population here in Marion County equaling all of the eight other surrounding counties combined. Nevertheless, we cannot ignore even a moderate rise in the level of infection. Dr. Kane will have more to say on this as well. But before she does, I'd like to take this opportunity to speak directly to residents of Marion County and the city of Indianapolis. We are not done yet. We're close, but we're not done yet. And I know it's been an unbelievable year, but we must keep our guard up even as we make the effort to return. We've done a great job till now, and we can hold large events safely if we follow the proper safety protocols. So let's keep going until we're done. That means wash hands, wear a mask, keep distant, and above all, get your shot. More than anything, the vaccine gets us to a full herd immunity without more serious illness or loss of life. If you're hesitant to get the vaccine, talk to a doctor, talk to Dr. Kane, talk to a trusted friend, talk to a family member who has received the vaccine. And if you got your shot, shout it out from the rooftops and on social media. Meanwhile, we're continuing our efforts to expand vaccine access and to try to, whenever we can, counter misinformation. Applications are still open for the COVID Community Recovery Grant Program, which will help fund community groups helping neighbors schedule their shot. Likewise, we've had two mobile sites that took the vaccine directly to over 800 residents, overcoming transportation related barriers. Two more are coming this weekend, along with continued efforts to connect folks to the vaccine, getting us to herd immunity, and in so doing, back to the things we love. So, for the last time, we're doing well, but we're not done yet. Get your shot. With that, I'll hand things over to my partner, Dr. Virginia Kane, head of the Marion County Department of Public Health. Dr. Kane.
Thank you, Mayor. Before we get to the data for a few moments, I'd like to expand on Mayor Hotset's comments on our continued efforts to ensure vaccines reach to our neighbors and our community reaches our herd immunity. First, applications are still being accepted until April the 30th for the COVID Community Recovery Grant Program. We are continuing to invite community-based organizations to visit marionhealth.org/community recovery grant. And it's just to fill out a simple 2-page online form that outlines details such as the COVID-19 related need, key activities planned to address that need, and how the requested funds will be used. Directions for other ways to submit an application can also be found on the website. Now, if you missed the grant orientation, don't worry. You can find a recording by visiting the city's Office of Public Health and Safety on Facebook, facebook.com/Indy, capital OPHS. Now, additionally, my staff will host a virtual office hour next Thursday at noon, where grant applicants can pop in anytime to ask last-minute questions. Information on how to sign up will be released following our press conference. So any interested applicants can also call 317-221-2305, or you can just email the health department at marionhealth.org. Now, second, an additional pop-up vaccine clinic, which will be held this weekend, is targeting a Pacific zip code to ensure vaccines are reaching our people of color neighbors. And on May the 1st, the local Omega Psi Phi fraternity will host a special vaccination event at our new clinic on the east side, located at 9503 East 33rd Street. Now, meanwhile, any residents you're 18 and over can get their vaccine even today at our new vaccine clinic serving the east side. And residents 16 and over can get their vaccine as soon as tomorrow at our vaccine on the west side. So all of this can be accessed by either visiting our shot.in.gov, or you can call 211. Now, when we return to the data, you will notice that our numbers are higher than our previous update. However, we're beginning to see a plateau of the surge. And I am confident this is because our community, we're doing our part. We're remaining vigilant in the ways we can continue to stop the spread of COVID-19 and return to the things we love, like the Indy 500. So please, continue to mask up in public, regardless of your vaccine status. Continue to remain socially distanced from those outside of your household. Continue to wash your hands when in public, and importantly, whether with the help of our partners at the Indianapolis Motor Speedway or at one of the Marion County Public Health Department's clinics or any clinic in our county, if you are over the age of 16, get the life-saving protection offered by this COVID-19 vaccine. It can save your life, your loved ones, your friends, your colleagues, and make this community safe. And now I'll walk through the data for Marion County. So in this slide, you can tell that in the top green up there, that we were seeing a downward trend, and just very recently, in the last week, we've seen it start to have a mild surge, very similar to what's happening in the state of Indiana. Next slide. And now when we look at our positivity rate of how much COVID spread we have in the community, back in the, I want to say about March the 22nd, around that time, we had gotten down to a positivity rate about 2.7. but we've been seeing a gradual increase, a very slow increase, but still a gradual increase in our positivity rate. And as of April the 14th, we reached 6.0%. Next slide. When we looked at our newly confirmed cases occurring on a 7-day average, April the 12th, we reached nearly over 200 cases. Exactly, I believe 202 cases. But since then, since April the 12th, this past week, we are starting to see a downward trend. So we have now cut down our cases by at least 50 cases. And we're currently at 152 cases on a daily basis when we were at over 200 about a week ago. So we're definitely on the downward trend. Next slide. When we look at our emergency room visits, although we saw a very slight increase back from March the 22nd, we now have plateaued, we have flattened in the past 2 weeks for ED visits with individuals who have COVID-19 symptoms. Next slide. For first-time hospitalizations, we're seeing similar rates for persons who are positive for COVID-19. We have seen a flattening of the number of hospital admissions for COVID-19 since the end of March. Next slide. And of course, we are still maintaining less than 1 death a day related to COVID-19 all the way through April the 16th. Next slide. So when we look at how we compare to other cities, new cases per 100,000 residents, you will see that Detroit is off the charts, that they have a total of 75 new cases per 100,000 residents, and at 25 and 26 cases, you can see that we're at least a third of the new cases that are taking place in Detroit. In Cincinnati, it's averaging 12 cases. Columbus, Ohio, 19 cases per 100,000 residents. Next slide. And when we look at our cases compared to the central Indiana counties and our surrounding counties, you will see that we went from March the 22nd, almost 1 month ago, when we were at 10 new cases per 100,000 residents, that we've seen an increase go up to 16 cases. We saw a similar increase in cases in Hamilton County, going up from 12 cases as their baseline per 100,000 residents, all the way up to 17 cases per 100,000. And we have also seen similar increases in Shelby County and Hancock County. But we've noticed a significant decline in Johnson County, going from 19 cases per 100,000, dropping down to 14, with basically Morgan, Boone, and Hendricks almost flattened and staying about the same number of new cases per 100,000 residents. New slide. So, of course, in terms of what's happening in the month of March, we've started to see a slight increase in our cases in our 0 to 20 years of age, with over 75% of those cases, representing 18% of those cases, are in our 18, 19-year-olds who are contributing to the majority of those cases in the children. With the largest group remaining at almost 50% between the ages of 20 to 39 years of age, followed by 26%, almost 30% in the age group 40 to 59. And we're continuing to see a significant decline in our seniors over the age of 60, representing only 10% of the cases that we saw for the month of March. Next slide. So, who's having the greatest increase of cases? It is our college students, 18 to 24, you can see this navy blue line where it is experiencing and having the largest number of cases, which occurred way back in January. And we saw a significant decline just at the end of March, but now seeing an increase again in the early 2 weeks of April for the 18 to 24-year-olds. Then that's followed by adults 25 to 64 who are having the next largest group of cases with our K through 12 years of age. That's that nice, very red line that shows that we're experiencing less than 25 cases per day through April the 20th, with the lowest rate of cases are our young children less than the age of 5 years of age. But our adults from 25 to 64 are much higher in the number of new cases compared to our older adults over the age of 65. Next slide. So now, when we last had our press conference, Mayor, we were at a vaccination rate of 16.4%. We now are at 21% of our Marion County residents fully vaccinated through April the 18th. We are a fifth of the way where we need to be, but we have ample supply of vaccine now willing to be provided to any resident that is eligible, 16 years and older, to get vaccinated. Next slide. So when we look at the percent of positivity rate, about how much community spread that we have, if you look in Marion County, our positivity rate through April the 14th is 21% of the people who are vaccinated in Marion County. And if we look at Hamilton, they have a higher rate of vaccinations for their residents. Boone County at 31%, Hendricks County at 31%, Hancock County at 31%, and Shelby County at 27%. With Marion County, Johnson County, and Morgan County roughly at a lower vaccination rate. And as you realize, we have a much larger population density of the individuals in our community, and at nearly 900,000, we still continue to have an enormous challenge getting everybody vaccinated compared to the other surrounding counties, which may be a little bit over 300-some thousand residents in their respective counties. Next slide. If we see how well we're doing in terms of vaccination by age group, you will see that we've reached over 50% of the age groups from 65 and higher, with roughly the largest group vaccinated between 70 to 74. And then as you get to a younger age, our vaccination rates are much lower. But you have to remember the scheme of making vaccines available was based on age. So we first vaccinated over the age of 80. We first vaccinated over the age of 70, and then over 60, getting down to 55. And so we didn't have as much vaccine available for our younger population. And so you can tell only 22% of our patients aged 45 to 49 have been vaccinated. And if you're 35 to 39, 12.8 are vaccinated. And yet the greatest number of cases, percentage of cases occurring on a 7-day average is the 18 to the 24-year-olds. And so really looking forward to the academic institutions being able to vaccinate their own students on the campus, which should make a huge difference come fall. Next slide. So when we look at the breakdown from a health equity standpoint of vaccination, we see that 23% of our white residents are vaccinated through April 18th, compared to our Black African Americans at 13%. In the next group, with our Asian Burmese population at 10.9% vaccinated, just rounded off to 11%, with the lowest vaccination rates for our Latino population at 8.5%, compared to our overall vaccination rate of 21% for the whole Marion County. But next slide. This is a little busy, but when you print it out, you'll be able to see it. But what's fascinating about this, that if you were over the age of 65, believe it or not, the Latino X population has the highest vaccination rate over the age of 65 compared to any other racial group, with the African American and the white residents roughly about 14% or 13% lower in their vaccination rates compared to the Hispanic population, with the lowest of the Asian Americans almost 18% lower in terms of vaccination rate. But as we get younger, between the ages of 45 and 64, we now seem to see the health disparity gap, with our white residents vaccinated at 33%, followed by a 8 to 9% lower rate with our Black African Americans and our Latino X population, with our Asian population at about 8% lower than our white counterpart, who are the highest vaccinated in that age group. Now, Mayor, you might want to pay attention to this one. This is your age group, 25 and 44, and I know 44 and holding for you, sir. So you can see that the white residents, and which are included in this group, are nearly 16% vaccinated. And yet, if you look at the Black residents that are vaccinated, we're nearly a third of the vaccination rate compared to our white counterparts in that group of 25 to 44. And if you're a Latino, you've got half the rate of vaccination compared to your white counterpart in the age group 25 to 44, with the Asian population having the second highest rate of vaccination. And we just only recently started vaccinating under the age of 24, so all of these numbers are low. And so I believe that is my last slide. And I can stop for questions, Mayor.
Sorry about that. Thank you, Dr. Kane. All right, everybody. I think most people here know the drill. Please put your name and outlets in the Q&A box. We'll get to as many as we can in the time allotted. I will unmute you after I call on your name. So first up, we have Camila Fernandez of Wish TV. Camila?
Hi, yes, Dr. Kane, what are your thoughts about the Indianapolis Motor Speedway allowing 40% capacity for Indy 500 amid the pandemic?
So let me just say that, this is an outdoor event, which has a significantly lower risk of spread because it's outdoors. The other additional factor is that we've now had nearly 2 full months of vaccine eligibility for anyone over the age of 16 plus. And I think what IMS will tell you, that their health and safety experts had told Indianapolis Motor Speedway officials that events held outdoors have proven to be 10 times less likely to see COVID-19 transmission than those held indoors with people within the same proximity to one another. And so, I just want to say that IMS has been an excellent partner in collaborating on health protocols for race days. But I think perhaps the most important factor for us is they've been a really strong partner in promoting and supplying vaccines in Marion County. So I think those vaccinations in part have made it possible to get where we are now and can get us a little bit closer to herd immunity as they will offer them over the next month or more. But fans, you got to continue practicing the basics. We got to wear the mask when they aren't eating or drinking, washing their hands thoroughly at regular intervals, and keeping their distance during the event. But one thing I know, IMS has resources. They've got staffing, and I believe, got some good operational plans to help enforce these basics.
Thanks, Dr. Kane. Next up, we've got Leslie from IBJ. Leslie?
Hi, thank you so much. So, at the last update for Dr. Kane, I believe you had said that we would need to see about 2 weeks from then to see the impacts from March Madness. So now that it's been that amount of time, just curious, colleague would like to know how the NCAA tournament being in Indianapolis did affect the overall caseload and case rate here.
So I can talk a little bit about our preliminary data that we have looked at. The final report's not out, but in our preliminary analysis, we were able to determine of all of our cases that less than 1% of our cases was related to the NCAA tournament. And yet we saw a significantly higher rate of cases occurring because of spring break and travel being brought to our residents here in Indianapolis. And so while we're still working to analyze this data, I can tell you that our contact tracers feel that more of our impact on our community was from the spring break travel than from the tournament, based on less than 1% of the cases were in any way connected with the NCAA tournament.
Thanks,
And
Dr. Kane.
One other thing I want to make notice of, that while we were seeing, now worth noting that this recent uptick in cases that we've just seen just recently in many places across the county, we also had our surrounding counties have an increase in their cases, and they didn't have an NCAA tournament. So I think that's another just major point I wanted to emphasize.
Appreciate that, Dr. Kane. Next up, we have Sherry from the Star.
Hi, Dr. Kane. I'm wondering if you can talk about, in terms of the people who are falling ill, are they going to the hospital? We're seeing younger people. Are we seeing milder cases? And do you envision that this is going to be what the pandemic looks like moving forward, especially if our vaccination rates hover about where we are now, given that it seems a lot of places are really seeing supply outstrip demand for vaccines, as places are offering walk-in appointments just aren't filling as much. So is this the future of what it's gonna look like?
So let me just say that I think our strategy of vaccinating people based on their age and getting the highest risk people related to deaths, the highest risk individuals most likely to be hospitalized, I think we made a significant impact in terms of where we're not experiencing a lot of those high hospitalizations that we're hearing about in other cities. But I also want to caution us too that we are seeing, and it looks like our youngest population is having the largest number of cases and may be the highest transmitters, our 18 to 24-year-olds to our communities, and they appear to be less at risk for hospitalizations. But if you turn your attention to Michigan, which has one of the highest rates of variant-resistant strains, we are now seeing a number of increase in our teenagers and older children being admitted to the hospital with more severe complications. We've been fortunate that we don't have the numbers like we see in Michigan or Florida or California, But I think we're seeing a substantial increase, but nothing like the level. I think Michigan are in the thousands, Florida in the thousands, multiple thousands of resistant strains. And I believe the state of Indiana probably has less than 300 cases to date. But that can change, and the risk can change for our younger population because these virulent strains might be more severe. We're just not at that point or stage yet.
Thank you, Dr. Kane. Our next question is from Amelia Pack-Harvey, also with the Star.
Hi, yeah, two questions. One is a technical one for Dr. Kane. When you say less than 1% of cases were related to the NCAA tournament, I'm assuming that's less than 1% of the newly confirmed ones from March 20th through April 19th.
That's about right. That's about the right time frame. Yes.
Okay, great. And then my second question was, is the county keeping track of any plans or contact tracing plans for the 500, or is IMS handling those? What plans in place do we have to monitor, trace this event to, since it's going to be quite large?
So let me just say we have a very robust number of contact tracers, of which the Marion County Health Department, in partnership with the Indiana University Fairbanks School of Public Health contact tracers, will be monitoring any of the positive cases or during the contract. That will be predominantly our responsibility. But the IMS also have their own contact tracers that we have to work with to assess any individual that's positive, that we have to know within a 6-feet radius, who are you sitting next to, where we retrieve the phone numbers, their home addresses, email address, work numbers in order to contact them. So it is our staff from the public health perspective are the ones who are doing the contact tracing. And sometimes the state Department of Health may be involved too, possibly in some of those cases, because a lot of the positive cases are reported by laboratory to the Indiana State Department of Health. And in Marion County, those names are turned over for us to do contact tracing.
Thanks, Dr. Kane. Our next question is from Russ Dodge of WITT. Russ?
All right, thank you very much. Dr. Kane, I wanted to talk about the under 40 age group, where we repeatedly hear that there are people in that age group that really don't feel they need to be vaccinated. The numbers bear out how many that have been vaccinated so far. Now, granted, it's early in the going for people to sign up there, so I want to know how the signups are going in that age group, and if they are low, like we believe them to be, what specifically are you going to do to market to those age groups besides the neighborhood clinics and some of the other really good things that you're doing right now?
So what I'm just going to say is that, let me just say we're doing focus groups right now. Doing focus groups based on the age group, trying to figure out from a messaging standpoint, what will resonate with you? What motivates you to get vaccinated? That is currently going on right now. We hope to kick off a major announcement. I don't want to be premature, sometime in the coming weeks, about our campaign message and what we're doing. And we're going to have some critical partners that may assist us. And I don't know, Paul, you may want to talk about one of our partners.
Well, Dr. Kane, we don't want to give away anything coming up in the near future until we get the details finalized. But I'll say that we've got some great partners, and we look forward to making those announcements.
He likes to tantalize you, so I'll have to let him have his way. He's the male in this situation, and mayor for the day for right this hour.
Thanks, Dr. Kane. Our next question is from James Briggs of the Star.
Dr. Kane, you said it a while ago, we've been fortunate we don't have the numbers that you see in Michigan. Michigan is our neighbor to the north, though, and presumably a lot of people who live there will be interested in attending the Indianapolis 500. Do you have any idea how many people might be coming from Michigan, and did that crisis there, and it really is still a crisis. There are hospitals this week that are overloaded right now with patients. Did that factor into the thinking on the Indianapolis 500? And one other question on that, why will there be temperature checks at the Indianapolis 500?
So let me just say that, some people use temperature checks as an additional protocol procedure to try to identify who might be ill. Granted that method identifies less than 2%, but it can be an additional tool to identify if someone has a fever. Of course, we have to be very concerned that it may be related to coronavirus, and they might be able to remove a roughly 2% of a population if they had COVID-19 could be identified by that. But of course, you're right. People can have coronavirus. They can look great, feel great, have no symptoms, and just by normal speaking can put some invisible respiratory droplets in the air. We did go over in terms of looking where we thought, and they keep a track of this with their season ticket holders, where their participants or fans have come from in the past year. For example, our expectation is about 500 people, international travelers that are not part of the race teams, will be attending this event. And we do look to see what they pull from Michigan, Ohio, and Illinois.
Thanks, Dr. Kane. Think for new questions, we got one more. Erica Heron, you're up next.
Thank you. I was just curious, Dr. Kane, I know a lot of schools started sending back middle and high schoolers kind of 100% for the first time this year, earlier this month. I'm just wondering how that's been going, and if you can give us an update on how many schools, if any, we have in those red and orange categories.
So we have done extraordinarily well compared to prior to this part of the school year from January currently now. That different things that we've put in place and the restrictions that we have in place, that we're roughly averaging less than 2 schools per week in the red. So that's remarkable. But we did have one instance where we had a significant number of cases, multiple cases in one school that kind of reached a really high level. But currently, on the whole, our schools are doing well with significantly less transmission of infection compared to the first part of the year, starting back in August all the way through Thanksgiving and near the Christmas season.
Thank you, Dr. Kane. From what I'm seeing, I think everybody with their name on the list had a chance to ask you a question. Please feel free to follow up with myself or the Marion County Public Health Department if you have any additional questions. The Marion County Public Health Department will be sending out a press release with more information, as well as the slides from today's biweekly COVID update. I think that's it. So we will see you in a couple weeks. Thanks all.